Hello everyone and welcome. Today I'll be your host for this webinar. I'm Aida Kasalkhe, a third-year medical student at Kazan State Medical University and the Public Relations Officer in PRASHA. PRASHA stands for Progressive Alliance of Students in Healthcare Advancement. It's a nonprofit student-led organization with the aim to promote healthcare advancement through the networking and collaboration. Today we're having our second mental health webinar. In the first session, we had discussion about understanding the mind-body connection, the doctor-patient's relationship, and mental health in medical practice. And today we're having discussion about mental health insights for medical practitioners. And I would like to welcome our host, Ms. Aditi Jain. She is a psychologist and assistant professor of psychology. But before we begin, I would like to review a few rules. Please keep your cameras off and mute your microphones. And at the end of the session, we're having question and answer. Please be free to ask your questions in the chat box or raise your hand at the end of the session. And I hand over to Ms. Aditi Jain.
Uh, Hello, everybody. Am I audible to you all?
Yes, you are audible.
You're right. So I just want to start with sincere apology. Since my Lenovo laptop ditched me with camera and I was trying to figure it out, and this is the Samsung which is saving me. Yes, I am softly sponsoring them. No jokes apart. Guys, technology was a bit hard on me today. So let's go ahead from here. I can see some of you who were there in the last meeting also. And it's good remembering the name. One of your founders told me about a lot of people turning up for this, but I can only see like a quarter of the total registrations. So can somebody indicate if I should wait for a while or should I begin with the session?
We can start with the session and I'll let people in.
That's all right. Okay. So hello, doctors, upcoming doctors. I hope you all are doing well on a Saturday evening. And I'm thankful that you chose to be here with me discussing on mental health instead of maybe going out to a club and party. So thank you for being here. And the last time we were discussing certain things which were related to the mind-body connection and the prevalence of mental health issues in the doctors and the learning doctors community. So today, one of your founders told me that you have recently started with the research here when you people are working on researches related to medical sciences. So it just gave this idea to me to uh, keep this presentation a very research based. So what I've done is I have figured out researches which is also known as review of literature. If you are on it yet, if you have learned even a bit about research, so you will find out there's a portion of review of literature. So while we are working upon some topic, we review the existing research on that particular topic. So while I was going through these papers over the internet, over sites like Sci-Hub and ResearchGate and all, Google Scholar, I was with the opinion that I might be finding very less research on medical health professional or like a medical students. Uh, it came with the assumption that most of you are already into healthcare sector and the mental health issues might not be affecting you that much or you may know how to regulate them. But while I was going through the ResearchGate platform and the Google Scholar also, I figured it out that there are a hell lot of researches about how mental health issues are quite prevalent in the medical students. And to my surprise, there are very systematic researches on how they increases or how the intensity increases while coming from first year to fourth year. So I would just begin with the presentation and let me just take a second to present it. Can somebody tell me you can see the PPT? Hello, am I audible to everybody?
Yes.
Can somebody tell me what you can see on the screen? Is it the
Um,
PPT?
You can see the presentation.
You cannot see the Microsoft window, right?
Actually, we can see this recording window.
Hello, Aditi.
Hello.
Could you drag and drop to that pop up to the yeah, it's clear.
So now can you see the presentation?
Yes, please go ahead.
yes, it's clear. Yeah, it's perfect.
Thank you so much. So am I visible to you? I'm sorry, I'm asking stupid questions maybe because I'm just figuring this out, but do not mind it. Can you tell me, just a second. All right, so we are starting, and the first slide that is
Excuse me, Aditi. I'm so sorry to interrupt, but we cannot hear you.
I think you are on muted, Aditi. Please unmute yourself.
am I audible now?
Yes,
You are
you are.
audible.
And your camera is off as well.
But the camera cannot be turned on because it is not giving me the option. Microsoft Teams is not giving me the option at the same time.
Okay, that's fine, but your microphone should be on. And there's this recording thing on your screen. So if you can please remove it.
Which recording thing? I don't.
Please turn off that pop up. Yeah, this pop up.
Yeah, so should I just. Okay, just tell me now. Is it fine now?
Yes, it is fine. Please
Am
go
I
ahead.
audible?
Yes.
Okay. Is there anything extra visible on the screen?
No. Please go ahead.
Okay, then I'll start with the first slide itself. I was telling you about my university affiliation, which is Vishwakarma University, and this is in Pune, and we are working on sustainable development goals. So there are two major goals that we are focusing on with this webinar, which is SDG 3, which is good health and well-being for the global society, and the second one is partnership for the goals. So I am considering this webinar as a medium of being a partnership at a global level of us and PRASHA as an organization working towards and for the global community. Uh, right, coming to my first slide, if you can see, this is the first research that I have cited, and it is related to the determinants of mental health and well-being. So if you can see this, all of the slides will be divided into three portions.
Excuse me,
Right,
Aditi, but
right.
just the next slide is we cannot see the next slide.
You cannot see the next slide.
Now it's visible.
Now it's visible to you.
Yes.
Okay, so the first, right. So the first slide, if you can see, it is divided into three portions. The first portion is the topic of the research, a title of the research paper. The second one is the people who have done that research and published it. And the third one is I tried to summarize the researches into a paragraph. So this is a research done on the medical students at a university in Hungary. They use certain methods. I'm considering that most of you are maybe aware of, may not be aware of research methods, but there are things like you have to choose a sample from the entire population on which you want to do research upon. And the second thing is you choose your variables in the terms of what you want to research upon. So we see if there is, in this case, we want to see the prevalent determinants of mental health in medical students. So those mental health conditions are the variables. The third thing is we always have something scientific to measure that phenomena. Here in this case, if you can see, they have used certain items based questionnaires. These questionnaires are standardized. Here they have used general health questionnaire, GHQ. You can read in the methodology portion, it is written 12 item general health questionnaire. That means there were 12 questions and they had their norms, reliability and validity, which measured, which made this questionnaire standardized. And this questionnaire was used among students to measure psychological distress and general health. So the results that they have found out are given in the next para, that it indicated notable psychological distress. And I have written it here that there was a significant positive correlation with perceived health and significant negative correlation with psychological distress. So their main variable was sense of coherence, SOC, which is denoting sense of coherence. And they have figured out that when the sense of coherence was high, there was a less psychological distress. And when this sense of coherence was low, there was more perceived psychological distress. In the conclusion, they have mentioned that psychological distress was greater in our sample of Hungarian medical students than in the same age group of the general population. Now, there is this another observation of mine, which is about the research which were done on simultaneous populations. And it was found that the medical students were having a high proportion and a high reported proportion of mental health issues in comparison to the students of other fields, also to the students of same age group. So even if it is like a person who is in 5th year of a medical course, they, if you compare them with somebody who was probably working in the same age, they have found that it was significantly more in the mental health students. Now, I would request you to please do not take it upon yourself that I am a medical student, so I am supposed to have some sort of mental illness issue or something like that. No, that is not the truth. But the researches that we would be studying in next slides, they also shows that it is high because of certain conditions. And the researchers would also be pointing out what are the coping mechanisms you can use to cope with those issues. So if you can see the second research, I think it is visible. Did you see a change in the slide?
Yes.
Can you see the change in the slide?
Yes, we can.
All right. Okay, so this is one of the research from freshmen to the other years, and they were talking about how there is a increase in depression and the decline in sense of coherence and mental quality of life in advanced medical students. So I've summarized the entire research into a paragraph. So they figured out that there are certain psychiatric disorders like burnout, depression, anxiety, which are common among medical students, and these are increasing throughout their studies. this study found that there are rising depressive symptoms. If you're not aware, I would just like to inform you that when we talk about illnesses, specifically in psychological domain, we there is a list of symptoms. I'm sure it is there with all the physical illnesses also. So when you match these list of symptoms, so there may be a time when those symptoms are less, or they are not that prevalent in a person. But over a period of time, it was shown here in this research that those symptoms rose with rising semesters, and there was a decline in the quality of life and sense of coherence. And they've also suggested that implementing coping strategies early in the curriculum would be helpful in dealing with such rise in symptoms. They have suggested techniques like relaxation techniques and others, though in later stage of this presentation, I would in detail discuss the coping strategies. The third research is on the mental health issues among medical students in Asia particularly, and this was a systematic review. If you can see in the heading of it, it is mentioned from 2000 to 2015. So they have done this longitudinal study over the span of 15 years, and they are talking about medical students specifically in Asia, and they are talking about the high levels of stress that they are facing, which is eventually leading to the mental health issues. So here, last time we have discussed about psychosomatic causes of diseases, and we also discussed about diathesis stress model, that how your psychological, emotional, and social conditions are responsible for one illness. So it is again asking us to take the holistic approach, how stress through different situations, different environment is leading to mental health issues. Now, this study analyzes 14 articles. Now, to all the people who are interested in research, you can see a difference in two of the data collection method and study method. First was doing the questionnaires, implementing those questionnaires on individuals, analyzing their results, and then reporting a final statement. Here it is a review of the literature that is already available. So they have analyzed 14 articles, and they have found uh, that up, and they found a prevalence of depression at level 11%, and it was telling that with preclinical and homestaying students were more affected with it. Now, all of these researches highly talks of the need to develop an intervention. If you can see in the past research also, they are saying that we should be implementing coping strategies and could do more to address such issues. This research also talks about need to develop interventions. You will come across a lot of researches which are just talking about developing intervention and improving mental health in students. To your surprise, also to mine too, I found that there are not much studies about what to do actually. So, which that was a bit surprising part too, other than relaxation techniques. The next research which you see is about mental health and quality of life in Brazilian students. We have done it in Hungarian students, then in Malaysian students, which is the next one, Asian students also. So I believe that it is not really cultural specific, that certain culture and certain countries are going through the issues. It is medical students all over the world which are um, going through these issues. One more request to everybody. I would like you all to just quickly give a read to this research that I'm presenting, because there may be certain words or expression which I miss out on speaking, but you would get an entire gist of the research that they have done. So again, they're talking about longitudinal studies that they have done on mental health and quality of life on medical students. They evaluated the incidence, prevalence, and factor associated with quality of life and symptom of depression, anxiety, and stress in Brazilian students. When we specifically mention these factors, depression, anxiety, and stress, please understand that we are talking about the methods of questionnaire, the standardized questionnaire, which we are evaluating on the participants or on the clients or on the sample of medical students. So they have followed these medical students over the year of over 2 years, and they have evaluated them in like 4 waves or like 4 different semesters, and they have found out that these medical students have a high incidence of emotional disorders. Almost half of the students presented high level of depression, anxiety, and stress in 2 years follow-up. So here also it indicates that initially it may not be that high, but eventually over the follow-up of 2 years, it was found that there were high levels of depression, anxiety, and stress. Right. So the other data that they have mentioned is gender specifically also, with the females and with the non-white population also, and they have found out that the non-white population were associated with poorer mental health and quality of life in the follow-up. Now, this can be related to certain demographic issues, which this study did not explore full-fledgedly. But if you see, there are demographic issues like level of income in the family. That means financial backgrounds, the education loans and all. So that may also be the resulting factors in this research. But the another interesting observation that you can make in this study also, that they are saying this data can be used to plan preventive strategies. Again, they are not mentioning that what is to be done about this particular scenario that is existing. Another Malaysian study which is talking about prevalence of emotional disorders. These people also executed GHQ-12 on the people. This is a general health questionnaire. Since this is mentioned frequently, I would like to give a brief about it. So general health questionnaires analyzes all the conditions which are physical and mental. So they see the psychological differences also, and they have figured out the psychological difference. And they, by using this questionnaire, they have found out in Malaysian students that a 41.9% of medical students were found to have emotional disorders. In their conclusion, they are also mentioning that there was a significant association between emotional disorders and respondents' relationship with their parents, siblings, and lecturers, as well as a level of pressure prior to exam. So here it is visible that the relation within the family, that means the amount of social support. To those who were there in the last discussion, you might remember we emphasized a lot on social support and the role of social support in providing us a mental health support. So if something is prevalent and they have found out that it is related to the respondent's relation with the parent, sibling, and lecturers, as well as the level of pressure prior to exam, that means that these are the contributing factor to the mental health conditions in the medical students. They're also suggesting that early detection of this condition is important to prevent psychological morbidity and unwanted effects on medical students and young doctors. Basically, what they're talking about is if we prevent or if we work upon these social factors as well as the educational factors of the level of pressure prior to the exams and all, we would be eventually able to prevent the rising mental health conditions in the medical students. This is a study again is not talking. The next study is not talking about existing disorders and all, but this gives another perspective to us, which is of the medical students' perspective towards psychotherapeutic treatment and training. And it is not just about treatment and training. Moreover, it is about being psychoeducated in a way that you know about the existing psychological disorders. You are interested in recommending taking and learning about psychosomatic medicine, psychiatry, and psychotherapy. So what they have done is they took 366 medical students who were in their clinical training, and they gave questionnaire about the attitudes towards psychotherapeutic treatments. That means they're just asking, what is your view on psychotherapeutic treatment? What do you think about? Would you take it or not? So they have done this research on 366 students about psychotherapeutic treatment, their career plans, psychosocial distress, and socio-demographic characteristics also. Socio-demographic characteristic, as I mentioned to you, were related to the gender, related to the financial situation, and everything else, the cultures they are existing, the religious norms they are coming from. So they have done this research and they have found out that there was an overall high interest in psychological distress of patients in psychotherapeutic treatment methods. They also had high interest in knowing about it. The medical students were they were interested in knowing about it, though only a very few medical students are willing to specialize in psychosomatic medicine, take psychiatry as their profession, or go for psychotherapy as their approach. So the psychosomatic and psychotherapeutic career approaches were found to be a frequent option in
Hello.
women in comparison to
please,
men. Right. Is somebody saying something?
Yeah, I was saying the slide hasn't changed. Is it the prevalence of emotional disorders?
No, it's the next slide. I'm not sure
Yes,
why is it not changed.
it changed. It changed just now and then it reversed. Got back.
So is it fine now? Can you see the attitudes of mental
Yes,
students towards psychotherapeutic treatment one?
yes, we can see it now. Thank you.
Oh, I'm so sad. My bad. Can you just quickly? I just finished. I was discussing the results of it. So if you can, by the time I'm speaking around it, you can quickly give a read of the objective and the methods and the result related to it. I was talking about how psychosomatic and psychotherapeutic career choices were more frequent in women as compared to men, and it was also a frequent choice in the students uh, who chose who went through psychological distress to in their education years. So to make a choice related to pursuing psychiatry and psychotherapy, it was frequent in the students who went through it, who had either undergone psychotherapy or who were less oriented towards economic success and career. These were the students who were picking psychiatry and psychotherapy as main career choices. Should I move to the next slide if you have done reading this one? Okay, right. So they have mentioned another potential remedy regarding it, and they're saying that improved teaching of psychosocial competencies and psychotherapeutic knowledge, career counseling, etc., um, would help in psychoeducation basically. So it is like a food for you, food for thought, your thoughts. That don't you think integrating psychosocial competencies or psychotherapies or like a basis of clinical psychology in your curriculum would be nice. Like I'm aware that you people study psychology, but it is related to the psychological theories of Freud, behaviorism, and all of that. So instead of along with that, adding uh, papers like stress and coping or emotional intelligence or psychosocial competencies or psychotherapeutic knowledge, things like this would educate as well as help the students figuring out their coping methods, their way of dealing with things, and it would eventually in a longer run lead to maybe decline in the mental health conditions that students face during the medical studies. Right. I hope the slide has changed. Now it is the mental health, self-care in medical students, a comprehensive look at help seeking. Are you on it? I'm assuming the slide has changed, is it?
Yes, we can see it.
Right. So this specific study talks about how you can do self-care in medical students, or what should be done to promote help-seeking behaviors in medical students. This was done in Yale School of Medicine. There were 183 responders, and they run out three questionnaires. One is mental health questionnaire, the second is patient health questionnaire 2, and then there was a burnout inventory that they have implemented in data collection. Now you can read 2-3 regression methods over here, such as Wilcoxon rank-sum test or Cruxell-Wallis test and Kendall rank correlation. So these are the statistical tests that are used to analyze the data which is collected through the questionnaires. Now you can see that most of the students reported having a primary care provider. That means having a consultant doctor or somebody who is helping them out with the physical health issues. Then the second reporting is that only few reported having only 19% of students reported having a mental health provider, which was fewer than that of primary care provider. Now they're saying that 25% of students reported increased mental health needs since beginning medical school, and these students were more likely to agree that their needs were untreated. So even though they were identifying that there is a prevalence of mental health issues, but their needs were untreated, or this in the past, during their college years, they did not seek enough mental health care. Now there is another finding of this research, that majority of the student had stress, which was correlated with increased and unmet mental health needs. They also found out that burnout peaked in the second and third year students and correlated with stress and increased and untreated needs. Again, if you keep a mental health issue untreated, it would add on to the situation over the years. The reason being that our attitude towards something, our outlook towards something, and our coping strategy mechanism, they all crash down once we keep on forming those views around things, or we do not seek help around those prevalent issues. If you can see after the burnout line, there is a very interesting line which talks about most students reported comfort with asking for academic help. Those uncomfortable were more likely to have mental health needs for which they do not seek treatment. This point out something really interesting, that there is so much of academic pressure and there's so much of syllabus that goes on. The people who were comfortable with asking for academic help, they did not have to face much of the mental health issues, but those who were uncomfortable doing it, that means those who were uncomfortable asking for help with their studies, were the one who faced a lot of mental health issues, and and like their mental health needs were high, and in comparison to the people who were comfortable asking for academic support, and the people who were uncomfortable were the one who for which they did not even seek treatment. Though another interesting thing is that the stigma was low in medical students, which is in comparison better to any other field, that medical students are aware of the mental health issues and they do not have a stigma around it. That is like taking one step further into something. That's good that you have taken that step up. But the difference between the need for mental health care and the unmet need of mental health care, it influenced the rising cases of stress, burnout, and depression. So, academic help seeking and uh, supportive faculty relationship appear related to mental health treatment seeking also. Like if you share the load of your academics and share the supportive roles from other people, maybe from your faculty, maybe from your parents and siblings also, that act as a treatment, like that act as a that helps you dividing or releasing your psychological distress. So the targeted intervention for stress and burnout reduction, as well as incorporation of reflective practice, may have impact on overall healthcare seeking among medical students. They again talk about further studies should expand to other medical and professional schools, since they are assuming that they are coming with a assumption that most of the students in the global community would be facing the same, which is true. We can see it throughout. This study is from USA, the other study was from Brazil, then one was from Hungary, one was from Malaysia, the one was discussing entirely about Asia. The next study which you see over here is resilience among medical students, the role of coping styles and social support. So my objective here was to introduce you with the studies on the existing mental health issues, then talking about its existence in different countries among different medical students, the insights from that. And now we talk about the state of resilience among medical students. Just a second. I am trying to show you something. Can you see? I just open a link. Can you see the link?
Yes, we can.
Right. So when I'll be sharing you this PPT, all the headings, they have a DOI attached to them, or like a link attached to them. When you click on it, you would be directed to a original research paper which talks about um, that particular topic. And then there are also articles which are similar related to that particular topic given under every site. So you can always refer to it. This I just wanted to point this out. Right. So coming back to the presentation, yeah, just pointing it out that all these topics are have a reference attached to them, so you can refer to that when you get the PPT. Right. So coming about the resilience among medical students, the role of coping styles and social support. Medical students, sorry. I hope you understand the meaning of resilience. Before beginning, I just want to ask that. Do you understand the term resilience? Doctors, do you? Would anybody reply? Okay, so I'll tell you the meaning of resilience. That's fine. Yes, so whenever you are facing a setback in your life, your ability to bounce back from that situation, or your ability to cope from that situation and stay with a right mindset, a motivated mindset to appear out of it, is basically your resilience. So this particular paper measures that. It finds out about the resilience among medical students, and they're talking about the coping styles and social support. So if you can see over here, this research was done in University of North Dakota School of Medicine and Health Sciences, and they have found out that 81% of the respondents of not I'm 81% of respondents were depressed doesn't mean 81% medical students were depressed. the 81% whatever the number of student appeared for it, they found out that 81% were depressed, and 23% of those 81% reported that it was due to their inability to cope with the situation or to deal with the situations that they are coming across in their medical studies. So there was a significantly greater risk of depression that was associated with inadequate support from family and friends. An important thing to know here is that you might feel that some of your friends, it's okay, the person is not talking to you, that's fine. Let's just let it be. It's fine. It's okay. I fought with my mother, that's fine. But just to tell you that all these little incidents adds upon your emotional cycle of, like, it takes you into the repertoire of negative emotions. So making that positive relationship, maintaining that positive relationship, and seeking support whenever it is required from your family and friends would always act as a social support measure in your medical journey. Like, these are the people who would keep you grounded, would keep you motivated, would always give you the sense of lovingness. So this is one of the things that they tell, that how important it is to have a social support. And they also talk about the use of approach oriented strategies. Now I'll come to approach oriented strategies, what they mean by it, and what are the strategies that you can use into it. But they're saying that the use of these approach oriented strategies was associated with a decrease in the risk of burnout and decrease in the risk of depression. So social support, these coping strategies, and resilience to mental health issues, uh, high social support, high approach oriented strategies, and resilience, like, they are positively related to the resilience. That means towards you bouncing back from the mental health setbacks in your life. I just mentioned a model over here in the last slide. I hope you can see it. Is it visible? This slide is visible where the model is mentioned.
No.
Is it visible now?
No.
You can't see the slide.
Now it's visible.
Now it's visible? Right.
Yes, we can see.
You can see the 4 dimension. So basically it's a circle, and that talks about um, existing coping strategies. If you can see, on the top it is problem solving, and on the base it is problem avoidance. On the side, on the one side of it is positive emotional coping, and at the other side it is negative emotional coping. In between you can see there is a problem solving, there is positive emotional coping, and it gives rise to one of the best strategy, which is efficiency. Between positive emotional coping and problem avoidance, there is a hedonistic disengagement. And between problem avoidance and negative emotional coping, it is helplessness. With problem solving and negative emotional coping, it is preoccupation with the problem. Now, I would give you an example of each. So, let's start with positive emotional coping. Okay. Now, in positive emotional coping, you are not focusing on the solution of the problem, whereas you're just focusing on your emotions, that you experience emotions experience positive emotion while dealing with a problem. So the classic example of positive emotional coping is sense of humor. Like there may be an issue going on in your life and you like to deal it with humor. You like to make fun about it, you like to crack jokes around it, so that it gives you a sense of lightness, a sense of positive emotions around the problem. Is it the best strategy? I would say. Sorry, you saying something? I am not, sir, you're not audible. Can you say it again? Somebody saying something? Shall I continue?
Yes.
Okay. Yes, so I was talking about sense of humor as a way of experiencing positive emotions around a distressful situation. Can we say it is the best strategy? I would say no. The reason being, you might be having a sense of positive emotions around a situation, but um, it would not lead to solving the problem. So a mix of both problem solving and positive emotion coping is a best way around any issue. The example for problem solving is you make a planning around it. You decide your goal, which you have to reach. You decide how many days it would take you to work upon it. You decide what resources you would be needing, figuring out that resources. You planfully execute that thing. It would not lead to a distressful situation right before exams, for example, right? So this includes planful problem solving, also task-oriented coping, that you are focused on one task and you are coping in orientation to that particular task. This also include one interesting thing. I don't know how would you take it, but take it from the perspective that if I talk about suppression of competing activities, that means if there is a existence of a lot of competing activities in your life which may not be necessary to you, which may not be a addition to your curriculum, let's say. So if you find competition problematic for yourself, you might even choose a way which is suppression of these activities. The combination of problem solving and positive emotional coping leads to efficiency. The example of efficiency is you do the do the problem appraisal first. Like you appraise the problem and using your emotion side, you do a positive reappraisal of that problem. Like you look into the bright side of it, you reevaluate the problem, you set the goals again. Then maybe you do planned problem solving after it. So efficiency requires that you reappraise the situation in a positive manner and then you work around it. Uh, if you see the combination of problem avoidance, that means avoiding your problem altogether, maybe procrastinating it sometimes. Their combination with positive emotion coping lead to hedonic disengagement. A classic example for hedonic disengagement is, let's say, smoking. The smoking activities that you do, or any substance use that is temporarily taking you away from the problem. So there is a problem, there is a avoidance of it, uh, that you can do. No, you shouldn't do. That's the other thing. I'm just telling you the example that how people deal with the problem. So if you're avoiding a problem and if you are mixing it with experiencing positive emotions around it, the result is hedonic disengagement. Like, let's say for any substance use, you are using an activity which is taking you away from the problem and it is also giving you positive emotions. Does it solve the problem? No, it just avoids it for a while. Does it gives you positive emotions? Maybe. The another combination of problem avoidance, like avoiding problem totally, accompanied with negative emotional coping, like you cannot see the situation in a positive manner. You do not want to see a situation in the positive manner, or you are experiencing negative emotions around it. Along with avoiding the problem totally would lead into helplessness. The last combination is negative emotional coping with problem solving would lead into preoccupation with the problem. Like you would find resources, you would set your goals, you would find everything. But if you don't have positive emotions to motivate you to go around it, to motivate you to feel happy around it, feel the thrill in solving that problem, it would give you distress. You would feel distressed around that problem, and you would stay preoccupied with the problem. When you go through all these coping strategies, you might look at different research papers which are talking about different strategies around problem solving or different coping strategies. This was one of the most comprehensive model that I could find around coping. Another interesting model around coping is Lazarus model of coping, which is talks about two major problem solving or coping strategies, which is problem focused and emotion focused. So that was a limited assessment of a problem or limiting assessment of the coping strategies. Here, this model gives you a entire idea about how to analyze the situation maybe, and how to reappraise the situation. Uh, the suggestion that I would like to put here is, whenever you come up with a distressful situation or a situation of stress, the first outlook should be reappraising the problem from an emotional manner. Okay, if this is the issue, how is it impacting me? How it would impact me in a longer run? Okay, I shouldn't be feeling this bad around it. Now let's find how to resolve it. How much resources should I use to resolve it? So you the gist here is employing your problem solving strategies with positive emotional coping would always give you a right direction and right push to go ahead and do it. In Since your degree is such a long period of degree for the 5-6 years of your MBBS, I think appraising the situations nicely and then problem solving around it would always be beneficial to you. And with that, we come to the end of this particular topic. Uh, the house is open for questions. I would like to listen to you and answer to you back. Right. Am I visible, audible?
Yes.
Okay, can we just, I am sure you might have experienced certain question in your mind while going through the PPT. Can we take that questions right now?
Yes. Am I audible?
Yes, you are.
Yes, ma'am. Thank you for the excellent presentation. I have a question. All the examples of the researchers that are done, you showed those examples. They were all done on in other countries and students in other countries, right? So,
Right.
are there in the field of such studies which are focused solely on Indian students and the situation in Indian colleges, are there many studies such done, or is that field blank right now?
See, there may be a possibility now. If you focus specifically on Indian research forums, there are two things around it. First is the publication scenario. There may be a possibility that there are some publication around medical students in some journals, but I could not find it in the major journals like the Scopus journals, which are published on bigger journals and all, which also gives me an idea to go ahead with medical student as my field of research maybe in future, because there is not much published, that too well published research in terms of Indian students. There is, but it is not very prevalently out there in big journals. Does that answer
Okay,
your
thank you.
question, Sayan?
Yes, ma'am. Yes, ma'am. Thank you.
Okay. I mean, we can all work upon it if you feel like that's a good idea, actually, that we can pick the institutions which are in India, the medical institutions, the private and the government. And those two separate samples can be made, the students from the private institute and the students from the government institutes. We can pick the psychological variables, and we can use these differences in the socio-demographic population. One is uh, the private institution, the government institution, because that has a huge difference in the fee structure. That would also give rise to the financial situations and all that. So that can be the determinant factors along with the academics and psychosocial support and everything else. It's a good idea, actually. Right. Anybody else?
Hi,
Hope you can
it was a
hear
great
me.
presentation, by the way. But I had a question. Am I audible?
Yes, Shraddha, you are. Go ahead.
Yeah. Uh, I wanted to ask, like, as a medical student, we suffer a lot of like negative emotions, and like most probably it's because of the studies we go through, and the main concern is like whatever we study, we end up feeling like we have the like similar symptoms. It damages us internally, emotionally a lot. So I don't know, like, if there is any solution that you can give us for that.
Shraddha, there is a similar observation that I faced, like the similar symptoms I faced while I was going through my bachelor's and master's and everything else in psychological studies. There were times when I used to feel, oh, I am feeling anxiety. I just cleaned my table. Do I have OCD or something? Oh, this is the personality disorder that I'm having. But gradually over the time, the good thing around is that I learned about the diagnostic criteria of that particular illness. So when I picked the diagnostic criteria, I realized no, some symptom might match. Okay, I have a thing for cleanliness, that's fine. But is it obsessive and compulsive in nature? No, I do not have OCD. So while you are facing so much of it, there is one approach which is a problem solving approach again, that you can utilize in the same manner, that while you are facing some of it, just go through the diagnostic criteria of it, that how much does it take to call it a legit disease or legit symptom or legit illness that you're going through, and then you can decide, if it is existing in you or not, and if it is really existing, you should see a doctor. Okay, and if I think it's natural while you are reading a lot about it, it's natural to feel that in you. The best approach is to be educated, more educated on it, and read, okay, these are the reasons of why is it not existing in me. So that would be a nice approach. Another philosophical.
Thank you. That answers my question.
That's fine.
And I had one more thing.
Right.
There's like a decreasing trust on like our own field sometimes because of the kind of medications we have, and like when we study about the side effects, and when we are consuming it and we see a little of it, and we are like, there's a trust issue with the physician we have. Like, is there any solution to that that we can have?
I mean, okay, so there is a approach that we use in psychotherapy, and we say, so there was a time when a lot of farmers were doing suicides in India, And then there were institutions who were focusing on mental health strategies in implementing in those farmers, so that you apply cognitive behavioral therapy, you apply psychoanalysis and all in those farmers, and it would prevent them from doing suicide. So this was the approach of a lot of institutions and psychologists. The simple answer to this is it would not do anything about that situation, the farmer suicide thing. The result being, once you resolve the thing completely, it only giving a psychotherapy around it would not help. Now the same comes with your question, which is your trust into medications and medical professions and people writing those medications which have side effects. The point being here is, if you say that you should work upon your trust issues, I would say no, you should not, because that mistrust into some medications, into one form of medication, is genuine. You should have that mistrust. The better thing around it is you look for the alternatives in your field itself. I'm sure there must be alternative medicines also for that particular medication. So you can always pick the medication which have less side effects. You can always pick for the lifestyle. You can always suggest the lifestyle changes, because a lot change when the lifestyle disorders are cured. So if a lifestyle disorder is cured, that combination with a better medication, a medication with lesser side effect, so you educating yourself and you educating your client or the patient around it would create a sense of trust in you, and would also create a sense of trust in client also. He would be trusting you as a professional, that okay, you did not recommend him a medication which had a lot of side effects. So that requires a hell lot of reading, a hell lot of research in the market of the market, that what all is the companies are manufacturing, what all is required, what all can be prevented in terms of side effects. So that is something that would come from your side as an effort, instead of just working on the trust issues. Because again, it is not just trust to be worked upon, it is a bigger picture. Trust is one of the psychological domain that would automatically develop once you work upon the main issue. Shraddha, that clarifies, like, does that give you my perspective on it?
Yeah, it definitely did. Last question from my side. Is there any
Correct.
book that you will recommend me to read, like as a medical student for our community? Some books that we can read about psychology that will help us improve our mental states.
So I'm not a fan of advocating self-help books, because the reason being, now I'm not saying self-help books are bad or something. Please don't interpret it in that manner. The reason being, whenever I pick a self-help book, I find the same content to be in my psychology textbooks. Now, again, I am not saying to you to pick the psychology textbooks, but there is, I would just recommend you certain people you must read about, in terms if you want to get a positive perspective about things. There is a psychologist known as Martin Seligman. He is the father of positive psychology, and he very nicely explains you types of happiness and how you should which happiness you should be approaching, how you should be approaching it, the positive and negative emotions, hope, optimism. So Martin Seligman is one of the person. My favorite psychologist is Viktor Frankl. So Viktor Frankl is an existential psychologist, and he talks about you making choices in terms of worst of situations. So it gives you an idea that even if you are going through worst of situation, you should know how to be dealing with it, and the best way around is to make informed choices. Again, so I would say Martin Seligman and Viktor Frankl are the two people who would help you out. There is a book that you might come across of Viktor Frankl, which is A Man's Search for Meaning. It is about his life story, how he made logotherapy, which is again a psychotherapy in psychotherapeutic field. So logotherapy talks about that itself, the existential reasons behind you feeling misery, And even if you are in a bad situation, how would you come out? How will you come out of it? So I think Viktor Frankl would be a good read too. There is another psychologist known as Carl Rogers. He is a humanistic psychologist. Carl Rogers is a nice read again. That is all. I think that's more than enough for you to begin with. I'm sure it would take you some time, like another 6 months, to read entire Rogers and Viktor Frankl and Martin Seligman. So all the best.
Thank you.
All right. Okay. Anybody else? Adya, you are the host, right?
Yes.
Okay. Is there any else question coming up? So I'm asking the host to please send that PPT to all the people who attended this, so they can refer to the articles and read about them in detail. That might give you an insight, deeper insight into the existing situations. Okay. Anybody else with the questions? I think Utkarsh is trying to say something, but Utkarsh, your voice is glitching. It is cracking.
Is it better now?
Yeah, it is better. Yes, you are audible. Please go ahead.
All right, all right. Okay, so my question, actually, I wanted this question as a representative for the majority of our participants today, who are basically studying out of their own home country. So they are.
Utkarsh, you are not audible. Please, can you repeat that question again?
Is it better now?
It's kind of better, but you speak. I would try to figure it out. Yeah.
Yeah, okay. So my question is actually for the medical students who are not studying in their own country, but have gone out to pursue their undergraduation. And like
The voice has break. You are not audible anymore, Utkarsh. But so what I have made out from what you are asking is that what about the student who are not studying in their home countries, are living away, far away from their parents, and might not even have that much amount of friends as a social support. So what you
yes,
should be doing? Is it what you are asking?
yes, that's exactly what I wanted to ask.
All right. Okay, so I assume the later part of the question. I was not sure if you were going to add that or not, but I get it. It's sort of understandable that it is hard to stay away from the house. I myself is staying in a concrete-filled metropolitan city in Maharashtra, India, and uh, the situation around is kind of critical in a way also, that I am a professor and I do not have many friends. In a way, I cannot just hang out around like that. So it in a way creates a situation where you have to form and stick to your meaningful relationships. Calling your family daily, at least for like 10 minutes, is a must. Just inform them how was your day. Now this would help you in two ways. First, you would get to know what is going on in your house with your parents in and around. Second, it would give you a chance to tell them about you and self-reflect on your activities throughout the day also. So in that way, it would give you a reality check that what you have done in the day, what you have done in the past week, where you are standing in your life, where from this point you should be going ahead in terms of your career, in terms of your choosing a workplace, maybe in a country outside, maybe in your home country. So it would give you a clarity on a longer basis. So instead of, like, you may be talking to your home at like 1 hour, but just figure out these 10 minutes to stick to your parents and to yourself also. Reflect on your activities, reflect on the needs of yours and your parents, and and the expectations they have from you, the expectation you have from them, in a longer run, it would give you a sense of social support as well as give you a reality check and motivate you to stick to the goals and stick to the things that you should be looking up to. That is my take on it. Other than that, please enjoy your weekends into clubs and pubs with your friends instead of sitting on a mental health webinar. No, just kidding. Please come to the webinar. Yeah, that's all. Anything
Thank you so
else?
much. Definitely answered my question. Thank you so much.
Okay. All right.
Anyone else has questions?
Yeah. So it's just very lovely to have you all. I don't think there are any more questions. You all can anyway message me through the organization. I would try my best to get back to you. And thank you so much, Adya, for being the host.
Thank you so
Prasha.
much for your presentation.
All right. That's all. Can we end for today? Please go out. Please move out. Meet your
I'm
friends.
going to thank Prasha's collaboration, ASTM and TISSO, and also Prasha's team for organizing this webinar. And thanks everyone for joining today. Have a great evening.